No.
Okay, can you hear us now? But is there an echo?
Yes, we can hear.
Shelby? Do we sound okay, or is there an echo? We're okay?
Sounds good.
Okay. Oh, well, I just gave a whole speech to get us started. And you all just did.
So good.
So it was so good, impromptu, but just some clip notes here. We're gonna get started. And we're pleased to have Leslie speaking to us today, as she is a candidate for a research assistant professor in epidemiology. And we're not gonna be monitoring the chat during her talk, but if you put questions in the chat, you're welcome to do so. And when she's done speaking, we'll pull that up, as well as your faces. We can't see you right now, but we'll pull up your faces and have a Q&A at the end. And if there are any other audio problems, please either unmute to let us know, and maybe we'll try to look at the chat.
Yeah, I can look at the chat one.
Okay, all right, Leslie, please.
Awesome. Thank you, Ashley. So everyone can hear us online. I'm glad we got the technical issues out of the way. As Ashley mentioned, my name is Barnard. I very recently defended my dissertation in the DRPH program here at the Colorado School of Public Health in the Epi department. Most of my research focuses on injury and violence prevention, but specifically firearm suicide prevention. I've been recently diving a little bit deeper into the mass shooting space, and so I figured I would pivot a little bit for those of you who are at my dissertation defense, sort of talk about something new for once. So I'm excited to talk about this really, what I think is a really important topic. But I do want to note that this is a really heavy topic. And so if anyone in the room needs to get up and go for a walk, I won't take offense to that. If anyone online needs to hop off because it's just too heavy, take care of yourself however you feel you need to. All right. Actually, there we go. Okay, so just to orient yourself around what I'll be talking about today, I'll first touch on some of my relevant personal and professional background, and then jump into defining the problem of mass shootings, talk about prevention a little bit in the mass shooting space, and then finally some future directions that I hope to be a part of. Throughout the presentation on the bottom, I have sort of each of these 4 categories so that if you do need to hop out for a second, you can reorient yourself back into the room. Okay.
I'm gonna try to turn off the doorbell. Sorry, I don't.
Okay.
Because I know that's distracting.
Yeah, no worries. Thank you, Ashley. Okay, so to start, personal background. So I am a former competitive trap and skeet shooter. This is a picture of me in high school at the Junior Olympics. This next picture is of me in college. I was the captain of the trap and skeet team at the University of Vermont. And then this last picture is what I call my retirement. I no longer shoot competitively, but when I'm with my parents, or particularly my dad, who's the one who really got me into trap and skeet shooting, I'll go and shoot sporting clays with him, just as at leisure, sort of when I can. And the only reason I bring this up is that as a result of being a part of the firearm owning community, I have experience with, in particular, firearm suicide. I have a family member and a former coach who died by firearm suicide, and a friend of mine's parent attempted to take his life with a firearm that he inherited. So it's an issue that is personally impacted me, and I think that I really ground myself in these personal experiences. And as a result of that, I think I have a little bit of a personal connection to sort of the implications of firearm violence, and it really is what motivates me to do this work. Okay, so as I mentioned, I went to the University of Vermont where I got my BA in biology. This photo is of me working in an ecological parasitology lab. My then mentor, Dr. Shaw, is the one who sort of listened to me about what I wanted to do with my life and was like, you are describing public health. And so that is how I learned about public health, and ultimately decided to get my MPH from the Tulane University School in Tropical Medicine. Initially, as a lot of people in Epi, was interested in infectious diseases, but got a job working on the Bogalusa heart study. which is studying cardiovascular disease. It's a somewhat famous long-term cohort study. And that's really where I fell in love with epi. I fell in love with data about how we can design it to answer questions or what it can't tell us based off of the way we're collecting it. And it really had a great impact on the way I view science and research and data. While I was at Tulane getting my MPH, I also worked at the Louisiana Department of Health. While I was there, I worked on a grant called the Every Mother Initiative, which was my first introduction to injury epidemiology. There we examined why those who were pregnant or recently gave birth, how they died, and discovered just how many died in violent ways, which was surprising to me. And I honestly, it was really my first introduction to epidemiology and the sector of injury and violence prevention. So, and I really did love it, which is what led me to continue my public sector work. After graduating, I went to the Vermont Department of Health, and then Public Health Seattle and King County, where I almost exclusively worked as an injury epidemiologist on various health systems, including surveillance and response programs. And then finally, most recently, I graduated, I defended my dissertation at the Colorado School of Public Health. And the experience that I had in public sector work is really what motivated me to continue my education, and try and get more experience in advanced epi methods. And it's been a wonderful experience working with the Firearm Injury Prevention Initiative here on campus. So, sort of culminating all of those experiences has led me to dive a little bit further into injury and violence prevention throughout my graduate studies. So I'm going to talk about a couple of studies that I was a part of and a couple of studies that helped frame the work that I did. But I think most importantly, when we're talking about like the most basic epi context, we want to define the problem appropriately. So what we know about mass shootings right now is that they're pretty rare events, with approximately 0.2% of all firearm deaths having resulted from a mass shooting since the year 2010. However, mass shootings have increased in occurrence since the year 2000. Mass shootings are associated with adverse psychological outcomes in survivors and members of the broader community. And we know some risk factors that are associated with perpetrators of mass violence, including mental illness, substance abuse, anger management issues, impulsive behavior, societal discrimination, and contagion effects. Important to the context of mass shootings instead of mass violence is perpetrator access to firearms. So just some basic information about mass shootings, sort of how we're approaching this issue. There is a problem within the mass shooting data sphere, and that problem is that there's no legal or agreed upon epi definition of the term mass shootings. So there's none that currently exists. There's also no federal agency that collects data on mass shooting events systematically. So you can imagine that trying to understand the problem is difficult when we don't have data to examine it. So in response to this, there have been sort of several grassroots or homegrown or different organizations have sponsored mass shooting databases as a result of this issue to try to collect data so that researchers can study mass shooting events. And importantly, the assessments of mass shootings that researchers do really hinges on the definition that they're using and the data set that they're choosing. And it's important when we talk about what's included or not included ultimately in these different databases. So this is a sample of the data sources that currently collect information on mass shootings in the United States. Starting on the upper left, the Gun Violence Archive is a nonprofit organization that collects data on this. The Department of Justice and the FBI, sort of collect information on this using their homicide report statistics. Unfortunately, though, it's a voluntary reporting by state, so not every state reports the enhanced information to the FBI to be able to collect that. The Violence Project is a data set that was created from a grant from the National Institutes of Justice. And then Everytown and Mother Jones are also other organizations that are attempting to collect information on this. These are the definitions that each of these data sources use to decide whether or not to include an event. So again, starting with the Gun Violence Archive, this definition is 4 or more that are injured or killed, not including the shooter. You can imagine that the data quality around 4 or more that are injured, so it results in no deaths, may be quite different than those that result in deaths. The Gun Violence Archives collects information mostly from news reports, and so the quality of reporting and the just detail of reporting is going to be different in each of those events. Moving over to the Gun Violence Project, this definition is usually considered the most strict. So this is 4 or more killed, not including the shooter, that are not associated with a crime and that have occurred in a public location. So in this circumstance, they're really trying to get at sort of our classical thinking of a mass shooting that's sort of this publicly seemingly random event. You can imagine that a domestic violence incident would be included in something like the Gun Violence Archive, where some 4 or more people are injured, no one dies. That wouldn't be included in the Violence Project data set. And so that has implications for equity in terms of how we are funding responses to mass shootings or potential mass shootings or any of that. A whole plethora of different circumstances that I could list out highlight how each of these definitions lead to different results, which leads to different funding, which leads to a host of equity issues. So there's a lot of choices to make as researchers when we're thinking about the data sets that we're using. And I think it's really important for us to sort of dive into what are these data sets telling us and what are they not telling us by the definitions that they're using. So one really cool study that I always am just baffled by is this study that looked at the overlap of the mass shooting databases. This one only included 4 databases. So the Mother Jones database, the Gun Violence Archive, the FBI's enhanced homicide reports, and then Everytown for Gun Safety. Sorry, I listed them in opposite order on the left, sorry about that. You can see the minimum victims for inclusion are listed in the next column. The number of shootings are completely different, as is obviously the ensuing fatalities and total injured, including the FBI not including any injuries in their data set. And then the overlapping Venn diagram showing the actual incidents that are included in every single data set is only 2, and you can see. So a huge host of differences based off of these definitions, also based off of their data collection techniques, whether it's from local police precincts reporting up to the FBI on a voluntary basis to deep dives into news articles or mortality statistics. So I think it's just really important to think about the limitations that we have based off of the data that's actually available to us. So continuing on to fighting the problem, as you all know, in November of 2022, Colorado experienced another mass shooting at Club Q. During this time, we were starting our work with the Office of Gun Violence Prevention and CDPHE with the Firearm Injury Prevention Initiative, and we had folks at the Office of Gun Violence Prevention ask us, why are there so many more mass shootings in Colorado compared to other states? And we were like, why are there? Or why do we think that there are? Those were all questions that we were like, we can probably try to answer this. So we went into the literature and found that there really isn't sort of this ranking of states or an examination of the actual rates of mass shootings in different states, despite the fact that Colorado has had a number of high-profile mass shootings that really sort of, I mean, I think in my own experience, I had this perception that Colorado has had more mass shootings than other states. So we chose to use the Gun Violence Archive. A reminder, the definition here is 4 or more injured or killed, not including the shooter, with no limits on the location of the mass shooting or if it being associated with another crime. And we did this because we wanted to get the widest breadth of information in terms of mass shootings. So we didn't want to exclude mass shootings that were part of domestic violence or drug-related activity or other illegal activity. And to really understand, does Colorado have more mass shootings than other states? And we also wanted to do a deeper dive into the types of mass shootings that the Gun Violence Archive actually does collect data on. So we wanted to look at the number and rate of mass shootings by state. We also wanted to look at the type and characteristics of mass shootings by states, and then look at that distribution across the United States. So along with other FIPI and Injury and Violence Prevention Center faculty, we published this in JAMA Network Open. It was intended to be exploratory, hypothesis generating analyses that really sort of highlighted the disparate rates of mass shootings across the United States. So this is our main figure. The top map shows a heat map of all mass shootings, and then each of the subsequent ones includes different types of mass shootings. We found from 2014 to 2022, there were over 4,000 mass shootings. About a third were social related, 16% were crime related, 11% were DV related, so domestic violence related, and 1.4% were school or work related. Our geographical analyses showed that there was clustering around the southeast region of the United States, which we thought was interesting given some of the geographic distribution of laws surrounding firearms in the United States. Again, this was supposed to be hypothesis generating, so it's a potential future direction that we're going to take this. But importantly, we found that, as you can see, Colorado is not necessarily highlighted as sort of this hotspot for mass shootings. In terms of ranking, it was 23 out of 50 states plus District of Columbia, so like really smack dab in the middle. So trying to find the evidence that shows that maybe this narrative that we have in our head that Colorado is this perceived hotspot is not necessarily true. Although, like I said, the choice of our data set definitely may have impacted that. If we had used a more restrictive definition, we might have seen different results. Super fun for this article is that it had a really high altmetric score. And I was interviewed by NBC and Time Magazine, which was cool, a very cool experience for a student. But like I said, this was an exploratory descriptive analysis. We didn't use any regression or fancy epi techniques. It was really basic, if I'm being honest with you. And I think that the interest around this article really highlights that we don't have really good understanding or really good peer-reviewed literature in this space. And we need to do better as public health researchers and public health communicators to highlight what we're finding and keep what we're saying sort of grounded in the evidence. So definitely a lot of potential for the future.
Just a quick question, was this the counts without a denominator?
No, we used the rates. It was, yeah, it's a
Okay.
per population rate.
Okay.
We did counts, but then like the maps are the per population rate per state.
Okay.
Yeah. Okay, so importantly, as I mentioned, I think this leaves a lot of space for public health communications. I wanted to highlight something that I found really interesting just based off of the data that we use. So on the left, this is our article, pulled out a quote from 2014 to 2022, about 11% of mass shootings were domestic violence related. On the right, another article that if you pull out the quote here, it's about 60% of mass shootings between 2014 and 2019 were DV related. So how can this be true that both of these are exist in the peer review literature and are valid, which they both are valid. The most interesting part to me is that we both use data from the Gun Violence Archive. So it's not a data set thing. You could say, okay, maybe those 3 years, 2020, 2021, and 2022 led to this huge difference, but that is not true. The difference is the one on the right uses a fatal mass shootings definition. So 4 or more killed, whereas we used the more general definition as 4 or more injured or killed. And so you can see how applying that new definition changes the results, but also the way we talk about it is almost identical. And so to me, that is a huge issue within this space, that I think we really need to do better about. So defining the problem of mass shootings is a lot more difficult than one might think. My favorite answer in epi is always it depends, but this one is kind of a hard one to bite off and sort of digest, because no one wants to say it depends when you're talking about something that is this contentious and emotional. So I think it's both an epi and a public health communications problem. I think that the discrepancies between our peer-reviewed literature often lead to conflicting evidence or seemingly conflicting evidence, even though both of those studies were completely valid. It can be extraordinarily confusing for someone to see both of those and try to make sense of it. And then ultimately, the biggest impact of that is that it hinders actions to reduce mass shootings, which is the worst possible outcome that we could imagine. So yeah, like I said, defining the problem is harder than it seems, oftentimes. Okay, so now that we have not really defined the problem, moving on to preventing mass shootings. So there are several ways to think about prevention when it comes to mass shootings. There's social cultural interventions, as I mentioned, several risk factors related to social cultural issues that we know perpetrators of mass violence experience. However, evidence understanding this in the mass shooting space and perpetrators of mass shootings in particular is somewhat limited. This is largely due to the lack of data that we have around this area. Also, social cultural interventions are more difficult to implement and to measure their impact. Not to say that they aren't extraordinarily important, but starting with the low-hanging fruit, I think, is important before we move on to some of the more difficult concepts. So one intervention that I think we can do a little bit better at measuring or attempting to measure is policy interventions that focus on access to firearms in particular. As I mentioned, the difference between a perpetrator of mass violence and a perpetrator of mass shootings in some cases may be access to firearms. And so if we limit access to firearms, the mass shootings component of it may be able to be removed. So again, the removal of firearms is one way to change potential perpetrator access, and then also secure storage of firearms. So the first policy I want to talk about is extremist protection orders. So extremist protection orders are also known as red flag laws. They're state level laws that have been enacted in response to a rise in firearm violence. So they can be used in the context of self-harm, in the context of directed threats of homicide of an individual, or they can be used in threats of mass shootings or mass violence. In Colorado, our URBO law was enacted in 2020. And just to make sure everyone sort of understands the common language, I get caught up in the jargon sometimes, but in the case of an URBO, a petitioner, so an individual, asks a court to determine if a person is at risk of violence to themselves or others, then that court will remove that firearm from the individual for a temporary period. In Colorado, it's a year. And then the person who's having the firearms removed from them is the respondent. So I may say petitioner and respondent, that's what I'm talking about. When the law was first passed in Colorado, eligible petitioners were law enforcement, family members, or people who, like roommates, people who resided with each other. And then recently, the petitioner group was expanded to include educators, healthcare professionals, including mental health professionals, social workers, and district attorneys. So that petitioner group has expanded since we've been looking into this data. So in addition to the known risk factors of perpetrators of mass violence, in particular for URBOs, it's important to show that I think these are potential tools that we can use. So previous studies have shown that 40% of mass shooters, they purchase the firearms solely for use in those events. And URBOs would prevent someone from purchasing a firearm if they're at risk of mass violence. In addition, plans to commit mass shootings were disclosed prior to the event in about 50% of mass shooting cases. So we can definitely see that URBOs are potentially a tool that we could use in these cases. So, during my graduate studies, I was a part of a larger 6-state analysis, collecting data on extremist protection orders. That was funded by the National Collaborative of Gun Violence Research, and we've since gotten a second grant, that's specific to Colorado to evaluate their use, which I'm really excited to continue to be a part of. So I led our Colorado abstraction team where we combed through each of these petitions, looked at each of the outcomes, and assessed how ERPOs were being used. So we wanted to look specifically in this larger 6-state analysis, how ERPOs were being used in response of mass shootings. And we published this in Preventative Medicine, just looking at the ERPO use in these 6 states specific to threats of mass shootings. So of all the petitions in these 6 states, we found that 662, which is about 10%, were petitioned for in response to threats of mass shootings or in multiple victims. They range from maximum casualty events, which are essentially someone saying, I'm gonna go to this crowded space and kill as many people as possible, to named, directed, targeted threats. So saying, I'm going to kill my whole family, kind of as an example. So definitely a huge range in the types of threats that that we saw, but important to characterize nonetheless. So sorry, this was really small. Each of the categories that we came up with based off of the petitioners, the petitions are on the left. The most common type was that maximum casualty event, which is represented over half of the ERPO petitions. The respondents were overwhelmingly male and white, over 90% for both of those categories, with mean ages in their 30s and 40s, which is pretty consistent with what we see in previous literature. K-12 schools and businesses were the most often named locations, and intimate partners were the most common subject of those named targeted threats. So I think it's important here to talk about that in this particular case, in this analysis, we don't know if any of the ERPOs would have actually prevented an ultimate mass shooting, because someone can make a threat for a mass shooting, but not ultimately sort of do that mass shooting. So that's one limitation of this data, but we're definitely seeing that they are being used in response to them. And I think that it's important to think about how this policy is being used in the case of mass shootings. So when I talked about policy and mass shootings, there's one policy that probably set off alarm bells in everyone's head, which is the Violent Crime and Control Law Enforcement Act of 1994, also known as the Assault Weapons Ban of 1994. And so I wanted to touch a little bit on this, this policy. Recently, I presented these results at a national conference and sort of did this next analysis I'm going to talk about with colleagues at FIPI and the Injury Center. But first, I wanted to talk really quickly about what the term assault weapon is. So this is the definition of an assault weapon based off of that law, which is most commonly used as a definition when we talk about assault weapons, but it is a relatively controversial term. It's not an agreed upon term. It's not sort of in any kind of space in terms of this is a legal definition, but it's not, people disagree about what an assault weapon actually is. For the context of the analysis I'm going to talk about, this is the definition I'm using. And essentially it boils down to a weapon with additional features resulting in greater firing capacity compared to other firearms, which also is somewhat of a confusing term in and of itself. So before I dive into sort of the analysis that we did, I wanted to talk about these two studies. There's not a lot of information out there about the types of firearms and mass shootings. So just quickly, I wanted to show that on the left, this was one study that was limited to 23 fatal mass shooting events with 73 victims. So immediately, that's not a huge sample size. It was also limited to one state. This study found that handguns had the highest fatality rate, even compared to those when using a rifle, but rifle events had more injuries than all other events, and none of this reached statistical significance. And this study didn't include information on assault weapons versus rifles and handguns, all of that. So it didn't pull out those extra characteristics associated with those firearms. The next study on the left looks at that assault weapons ban, that showed that there was a reduction when the ban was in place of mass shootings. However, it did not account for confounding variables. So important to consider. For the analysis that we did, we chose the Violence Project database, which again, a reminder of the definition we're using here, which is 4 or more killed, not including the shooter, not associated with the crime, and in a public location. And the reason we use the Violence Project data is because it's the only data set that includes information on the type of firearms to the level of detail that we needed. So all the other data sets don't include this information. And again, that's likely because these are the likely most reported on incidents, sort of our classical, what we all think of when we think of mass shooting, this random publicly targeted incident. And so it's the only database that includes information on the type of firearms used. So we wanted to assess when assault weapons were used in mass shooting events and determine if assault weapons were associated with a higher average number of fatalities or injuries. And we hypothesized that because assault weapons have one of those additional features that leads to the increased firing capacity, that this may mean that we'll see more fatalities or injuries in these events where they're present. This was the retrospective analysis using the Violence Project, and again, compared incidents where assault weapons were present versus when they were not. And here we just use legit linear regression to model the association between type of firearm and number of people injured and killed. And we did include important confounders here, again, that were collected by the Violence Project. Here we included the use of multiple firearms, firearm proficiency, so like the shooter proficiency with the firearm, shooter familiarity with the location, the shooter age, and the shooter gender. And these were all based a priori in empirical literature review. So what we found was that there were 184 mass shooting events with a single shooter, which was 3.2 per year. As you probably are thinking, this is very different from the previous analysis using gun violence archives, so that's definitely important to note. 1/3 involved an assault weapon, 79% a handgun, 21% a long gun, 19% a rifle. These are not mutually exclusive because they were an average of 3.1 firearms reported on the scene, and over half reported multiple firearms. The average age was 34, majority white, majority male, 44% had an existing relationship with the shooting site. So what we found was that incidents where an assault weapon was present resulted in an average of 2.6 more people killed when controlling for those important confounders that I noted. And then we also found that incidents where an assault weapon was present was not associated with the number injured after adjusting for those same confounding. So in this analysis, we found that most mass shooting events involved multiple types of firearms, and the most common type was a handgun. Assault weapons being present during these publicly targeted mass shootings was associated with an increased number of deaths occurring in that incident, which may be related to the features of the assault weapon. Importantly, this analysis only included mass shooting events where 4 or more were killed, and that may limit the generalizability to only those types of events. We also use the type of firearm present at each event as a proxy for their use, because we didn't have information about how each of the people were killed, especially in those multiple weapon incidents. And then finally, there may be uncontrolled confounding that we didn't account for. So definitely limited, again, to the data that was available to us, but trying to sort of include more information about the types of firearms and how they're associated with mass shooting events. So in general, more data is needed on the types of firearms used in these events so that we can really understand what's going on. Okay, on that super positive note, I'm going to move on to some future directions that I both hope to be a part of, but I also think are really important for the field sort of in general. So first, I want to touch on ways to expand that geographic analysis that I first talked about, that we published characterizing mass shootings. And then I want to talk a little bit about the broader impact of mass shootings, some additional thoughts on policy evaluations, and then finally, what I'm calling sort of a taxonomy of mass shootings and recommendations. So building on the geographic analysis that we did, I really want to understand the social and cultural and policy related factors that contribute to some of the clustering that we're seeing around the southeast regions of the United States. I think that broadly, the more policies that we see related to restricting access to firearms, the less firearm violence we see in those states. And so I think that there's reason to believe the same thing can be applied to the mass shooting space. However, we really need to do a little bit more digging into that to really understand what's happening. We also, as I mentioned, use the gun violence archive because we wanted to get the widest breadth of information about mass shootings using that really broad definition. But I think something that we still need more information in terms of understanding that breadth of impact is how are these things impacting real individuals? So beyond mortality or even injuries directly resulting in an actual event, what are the implications that we're seeing in terms of the broader community? So are there behavior changes that people are making for fears of mass shooting? And is that resulting in fears related to data, or is that fears related to media reporting? And what's going on sort of in that space? What are the mental health implications of that? I think I experienced this myself, and I think that we would be fooling ourselves if we said that everyone wasn't at least a little bit impacted by the way that we talk about mass shootings. So I really would love to dig a little bit deeper into this space. And I think it's a really interesting area. Finally, there's a couple of policy spaces that I think we need to do some more work. So first, building on the existing IRPA work, as I mentioned, there's a new group of petitioners that are eligible in Colorado, including mental health providers. And so understanding how mass shootings, the proportion of IRPAs that are being filed in response to mass shootings, if that's changing at all with this new petitioner group. Or is there a way that we can let people know that this is a tool that they can use sort of in their toolkit of ways to treat folks? There's also a plethora of safe firearm storage policies across the United States, which basically says that people have to store their firearms safely. And there's a wide variety of different ways that these are enforced, which I'll talk about on the next slide. In addition to other laws across the United States, like permit to purchase laws or laws that we don't necessarily think are directly related to mass shootings, but given that statistic that 40% of firearms are purchased for a mass shooting event, I think that these laws should be examined in this space. Okay, so when we're talking about the policy space, I think that this is such an interesting component. So Colorado in 2021 passed a safe storage policy that said that people have to store their firearms safely, and if they don't, they can be fined or charged with something, which is in theory great. A type of safe storage policy is called a child access prevention law, which is basically the same thing, but in particular talks about children having access or illegal access to firearms. So a parent has to store their firearms safely, and if a child has access to that firearm or gains access to it, they can be charged in a similar way. This is one study out of a group in Washington that showed that nationally about a third of gun owners who lived in states with a cap law thought that they lived in the state with a cap law. So the majority of firearm owners did not know that this law exists, which is, again, a huge problem. If we're talking about like a ecological analysis where we just look at, do these laws exist and what's the outcome, we're not gonna see what we think we're gonna see. If people who are gonna be the intended targets of these laws aren't doing anything to change their behavior, or don't even know that they could be implicated as a result of not changing their behavior. So again, I think this is a communications problem. I think people need to know the laws that affect them, and particularly when we're talking about firearms, the stakes are so high that I think we need to be better about communicating sort of what's going on in our own community, what laws do firearm owners need to abide by, and then also measuring when they know about them, and then ultimately when they're changing their behaviors as a result of knowing about them. So lots of different levels related to this that is fascinating, and I would love to be a part of sort of assessing that. Okay, and then finally, I think the summary really of this whole talk is lending itself to a taxonomy of sorts of mass shootings. So including the data sources, each of the definitions they're using, when to use them, how they have been used, what are their limitations. I think all of that needs to be more clear. And like I said, I love that study that was that I showed with the Venn diagram, and I think it really should be expanded to include all data sources. If that one only included 4, and there's a even more sort of data collection and data sources that are available. And I think we need to do better about helping researchers make informed decisions, and then also helping researchers think through all the limitations associated with those decisions. I also think that as a part of this, there should be some best practice language. So if we're all saying something is a mass shooting, but all using a different definition for it, I think that's where this really key miscommunication happens. So I think we need to come up with a way of being more descriptive in our in the way that we're using this language, and agreeing on using a mass shooting versus a fatal mass shooting, or talking about the types of threats that we're talking about. So like those publicly targeted sort of maximum casualty versus a domestic violence threat. I think there's huge differences in that, and we need to be better about the way we talk about it. And then finally, I think that there needs to be some federal data collection that's mandatory and systematic in order for us to do a much better job as researchers and public health practitioners at understanding this problem and ultimately sort of chipping away and making positive change. And these are all the studies that I mentioned in this talk, and I would love to answer questions now. These are my dogs, and on a happy note.
Thank you. And Leslie, would you mind unminimizing all the faces on the screen? Turn the lights back on. Oh, is it on that screen?
I think so. Sorry.
Thanks, Shelby. So we do have about 15 minutes for Q&A. And in case I was muted when I said this, would love to hear from the state agency partners who I saw were on the call. If you have things to share from your work. And you can put your questions in the chat or just unmute and start talking. Looks like Allison, you're unmuted. I don't know if you were gonna chime in.
I can start us off. Thanks, that was a really interesting talk. I really enjoyed your presentation. I was wondering sort of your thoughts about, the best study design to sort of point us in directions for intervention. Whether you thought there was value in doing sort of more ecological studies looking across countries to try to understand why the US has such a big problem, what are the societal level factors? Or do you think, we should do more studies like sort of what you've already done, looking across states to try to understand, sort of individual level risk factors?
Yeah, so there is a study that looks across countries at mass violence, at the rates of mass violence, that I believe it categorizes countries as either, and I know that this term is not necessarily an agreed upon one, but developed versus developing, and that the US ranks as #1 in terms of developed countries of experiences of mass violence. So I think that there's always more work to be done in that space. But I think the clear issue when we're talking about mass shootings in the US compared to other countries is access to firearms is a huge just like the sheer number of firearms that exist in the United States is so much higher than most other countries, and so we can definitely do more work to understand that, but I think that that's a clear, really important factor in when we're talking about mass shootings. I also think that, the real issue I see with more ecological studies or even more state by state studies is that we're so limited by the data that's available to us, even understanding the social cultural components. Like the Gun Violence Archive has very limited information. They have the incident location, the number killed and the number injured, and then any sort of characteristics associated with it. But that's like one variable, what characteristics are associated with it. It's not compared to like the Violence Project that has a whole sort of history of someone's mental health, but that's again, because it uses such a narrow definition. So I think having the ecological analyses are definitely important, but we're still limited by what questions we can even ask at an ecological level because we don't even have the data even at that level to understand. But I think before going into individual level studies, it is important to continue to work in the ecological space to generate hypotheses and ensure that we're like using dollars as appropriate as possible. So I don't know if that answers your question.
Yeah, no, thanks.
Mhm. Interesting.
Just, thanks, it's great. The definitional problem,
Mhm.
what can you do about it?
Yeah.
And I'll raise, we've organized for cannabis next month a workshop on harmonization of exposure assessment, which is a huge problem that also just challenges any use of the literature and meta-analysis, systematic review and meta-analysis. But I mean, this sounds like this must be a well-recognized challenge, but is it something that you can take on or your center can take on?
Yeah, that's a really good question.
I know.
Maybe above my pay grade, but yeah, I mean, I feel in some ways, I'm especially as a student, like a little bit powerless in that kind of
What's your job?
situation. Exactly, and I think, so I'm working with another student from UCLA to write an op-ed to try to bring more awareness to this issue, which I think is important, especially just understanding that there are issues with the data that we even have and the publications that we have out there about this. So I think that's one component. Like I said, I would love to create sort of a taxonomy of mass shootings with recommendations that hopefully would result in, or set someone, maybe myself, up for sort of taking that action to do the data collection and to implement it more. But I also think that I'm one person and having the support of centers is absolutely wonderful. And I would love to be able to get folks from both the mental health treatment community, all different communities who have sort of a stake in what to say in terms of what do we actually ultimately collect, like what's important to systematically collect. I think I'm limited as an epidemiologist, and I would love for this to be a collaborative group effort that we can reach consensus on. Yeah.
So don't be limited as an epidemiologist.
There are no limits.
There are, no- I mean,
Well, I want to acknowledge that I don't hold all of the expertise to be able to have that. And also, I think there's power in numbers in terms of creating advocacy,
we can talk later.
Yeah, sure, I'd love to, I'd love to.
I'm curious how the NVDRS, the National Violent Death Reporting System, fits into all of this. Can you speak a little bit about why that's not
Yes,
more useful to you?
yeah, absolutely. So NVDRS is a data system. I actually was an NVDRS data collector when abstractor when I was working at the health department in Vermont. So it's a data set I know and love. It's a difficult data set. So first of all, it's not publicly accessible. So in order to get access to information, you have to submit a request to the CDC for a host of reasons, including protection and privacy and ensuring that the data is being used appropriately. So I wouldn't say that that's inappropriate, but and it is at the incident level, so you can get information. So for one sort of event, understanding how many people are killed in that data. It does not include information on injuries, so having that broader definition wouldn't be included there. It also, there are imperfections for that data set, including missing information about the type of firearm. It's very similar to the other data sets in that there are things not necessarily collected systematically based off of the types of incidents that you have. There certainly is more information on previous mental health treatment and other risk factors that we might be interested in for perpetrators of mass shootings. But yeah, I don't know if that answers your question. There's still limitations associated with it, but I could envision, and I think I can connect this to Dr. Saman's question. I can envision a system similar to NVDRS specific for mass shootings, or including additional forms or data collection tools that sort of piggybacking onto the NVDRS system that would be more expansive when we're talking about mass shootings. However, especially for the folks on the call who are maybe involved in those sort of data collection systems, that is a huge ask. And without funding, I wouldn't want to recommend that, because I know that just from my personal experience, it's a very difficult thing to do with the dollars that are allocated for the NVDRS system. So asking folks to collect more information, I think, would be a big one.
Question in chat,
Mhm.
see that?
Yeah, so similar to Ashley's question, I'm wondering if you have explored the National Crime Victimization Survey to see if they have gun violence questions that could be helpful. I haven't looked at that data set. I imagine that's okay, so this is like among people who this is a survey, so like it would only include sort of the broader implications of mass shootings, I guess, or like survivors of mass shootings or people who know were a part of that community. That's definitely a great data set. I haven't dug into that, but I will. Thank you, Allison.
I have a question, Leslie. I can go back and read your preventive medicine paper, which I will, but I was just curious, you said it was a 6-state, right? So I'm just wondering, did you all have a chance to look at, were there any structural features of the FERPA laws in different states that might change how you're looking at, like, and then I have a short follow-up question, but yeah.
Yeah, so definitely. So I'll say right, and I don't think I had mentioned this, but there are IRPA laws in 21 states and the District of Columbia. So like that's also a limitation of the IRPA laws, that they're not a national policy, it's a state policy. And there are differences within and between each of the state policies, including different petitioner groups. So like in Maryland, there's a much broader petitioner group than was in Colorado when we did this study. And for example, in California, they have sort of an emergency line that's available, versus in other states, it's only when the courts are open will they hold hearings for this. So there's also limitations in that in terms of like an identified risk and then like removing firearms, which definitely could both impact like the way that the IRPAs are being implemented, but then also who is able to actually get them to be in use.
Okay,
Yeah.
awesome. So then quick follow-up question, very self-centered.
Mhm.
For future directions, are you interested in using or working with like legal epi type stuff for some of the work you do?
I would love to,
Okay.
yeah.
Very self-centered.
I think we can wrap up unless there's any burning questions on Zoom.
Ooh, I have one more burning question, if you don't mind.
Sure, Ellen.
Leslie, I was just wondering how you think about sort of the debate around mental health and the role it plays in gun violence. I mean, clearly it plays a role, but is it sort of a red herring in the sense that, you know, there are many people who have, most people who have, who experience mental health challenges do not commit gun violence. So, you know, really terrible specificity for sort of using that as the indicator of potential for gun violence.
Yeah, that's a great question. So, and it's definitely a contentious debate around this. So being careful in responding, I think, is also important. I think it's certainly, we know it's a risk factor, but I think that's exactly what it is. It's a risk factor of a host of many. without even the context of mass violence or mass shootings, like mental health issues are a pervasive thing across the United States that I think deserve a lot more attention and a lot more dollars and a lot more of everything that we currently don't sort of give it. However, I think in the way that it's being used in the context of mass violence makes it seem like an end all be all. And to your point, not all people who experience mental health issues harm anyone or threaten anyone. And so I think it's one risk factor in a multitude of risk factors that should be continued to be considered, but is not the ultimate component that everything should be focused on. There's a question.
Sure, I mean, yeah, please, David.
Sorry, jumping in here. I'm over at Boulder in the sociology department, so a bit of an outsider here, but I did enjoy this presentation with great interest, and I really do appreciate the work that you're doing. I work pretty closely with James Densley and Jill Peterson at the Violence Project, so I think they'll be thrilled to see the way that you've been using their data set. The JAMA network paper is really interesting to me, but one thing I'm curious about, and as a criminologist, this is an issue that's more like near and dear to my heart, and that's the ranking of states or places more generally based on, some of these unsavory characteristics, whether it's mass shootings or crime rates or so on. And I'm thinking about it especially in relation to, the trafficking of firearms across states. For instance, the way that a place like Illinois disproportionately receives firearms from a place like Indiana. And the sort of impact and harms that it could have on places for tourism, business, conferences, and so on. And so on the one hand, you find a pretty positive finding to say, hey, well, Colorado isn't the worst, even though a lot of people have this perception. But on the other hand, we've sort of kicked the can over to a couple of other different states to say, your mass shootings are much higher. I'm curious to see if there was any thought given to, these issues and the stigma associated with it, and how you potentially tempered it with some of the media correspondences you had.
Yeah, that's a really great question. And I think particularly maybe in the injury violence space, we focus on some of like the negative outcomes and talk about them a lot more than we do the flip side of the positive ones. And I think that's a way that is important to reframe our work. And I think your comment highlights that, like, maybe I should do that a little bit more. In terms of the way I spoke with the media about it, I mean, regardless of the rankings, these events are rare in all states. And so I think that's something I tried to highlight, is that if we look at the rates of this, it was per million population. So that's what we had to do in order to make the numbers sort of make sense, instead of saying 0.00000, whatever. And so I think that's one thing that I try to focus on, is that understanding that these events, regardless of even using the most broad definition, they're extraordinarily rare. Even if you're the number one state for that we found for mass shootings. I can't remember the other component of your question right now, but I definitely think that there's an opportunity to change the way that we talk about it to be less stigmatizing and also not threaten other states' economies or conferences or all of that list of things that you mentioned. Yeah, absolutely.
Maybe I could take the last word here and say, I think it's fair to say this is almost uniquely an American problem. And so maybe looking between, to harken back kind of the earlier, looking cross nationally, we can see that crystal clear. We don't have to compare states to show that, like,
Yeah.
we are sharing nationally in this problem.
Yes.
Yeah, I'll just say I'm hosting an international workshop here in 3 weeks, and all these international folks are saying, is Colorado safe? Can I come to Boulder? The King Super shooting. So it's just weighing heavily on my mind. So I enjoyed your presentation. Thank you.
Yeah.
Thanks.
Thanks.
All right, well, thank you, everyone.
That's really good.